I'll take us back to the transverse image midline. Now we're going to put in the temperature probes. Typically, I'll only put in 3 temperature probes, but today John has talked me into putting in a 4th probe over there in the left posterior side that we're sparing, so that we could show you that the temperatures in this left posterior side is not getting therapeutic. Let's go with the apex temperature probe first. All right.
Just talk a little bit about the rationale for sparing that portion of the prostate.
So the rationale for sparing the left posterior portion was that, according to our saturation biopsies, left posteriorly there was nothing over there that was positive. So that's why we were going to spare that one, and hopefully again spare the nerve that's over there so that he could be potent. That was a very big concern for him, is that he would still stay potent. Can I have a hemostat? So I'm going to put this right into the apex of the prostate. So John, can we go back to a transverse view? I mean the sagittal view. All right, so we're back at the sagittal view, and I'm going to put this probe into the apex of the prostate. This one, the grid will kind of tell you where you should put it, but usually we just eyeball this to get it there within the apex. And just twist it a little bit there. So you'll see where this is coming. There it is coming in. And we'll just put it right here in the apex of the prostate. Let's see, hemostat. The temperature probes do not, we don't obviously freeze the temperature probes in it, but there's a little plastic piece that we can wedge here within the grid that will hold the temperature probes in place. So that's the apex probe. Let's go with the Denavier's probe. So we put a temperature probes in Denavier. Yeah. Same as we did in the apex, monitoring the temperature in Denavier's. So we're going to go here quite posterior. So there you see the probe coming in for Denavier's. Again, prostate's above it. And I'm going to keep the probe here. And this one is just important to know exactly where the Denavier's probe is. Is it closer to the prostate or closer to the rectum? And that's just going to be important when you're freezing, so that you have some idea your leeway with your temperature. So that's Denavier's. And then the next one we're going to put in is the external sphincter probe, the ES. Yeah. So we'll monitor the temperature of external sphincter. And then here's the sphincter kind of right there in your screen there. Okay, I'm going to go up a little bit higher with this right there. And actually, I'm going to go up even higher for that. There we go, right there with external sphincter.